What's up, North County? I'm your host, Randy Doty, and today we have another episode with the Stacie Strong, and we have a special guest. We have Dr. Von Schaefer with Stacy Athon with us right now. Welcome, ladies.
Hi there.
Thank you.
Hi, Doctor. I just want to say thank you so much for coming on, sharing this amazing story, this amazing journey, and being a part of this whole Stacie Strong, path that we are all on, and hearing, sometimes for the first time. So I really appreciate your time here.
Well, thank you. I enjoy being here, and I want to share the information that we have because there are so many people who could be following a similar path to what Stacy did, and it leads to not only just survival but thriving, and that's a rarity when you have a difficult cancer diagnosis.
So, Doctor, I want to first ask, with the practice that you're in, obviously, traditional medicine is like what everybody, that's the focus. How did you go down the path to where you're at now with the alternative stuff?
Well, it's kind of interesting because in my mind, it's not really alternative. It's more integrative and all-encompassing. When I went to medical school a long time ago at Columbia, New York, I studied cell biology and biochemistry, and those were in the days long time ago when cellular organelles and electron microscopic pictures of things first became available, and it opened many doors to understanding how cells work, what goes on when things are right, what goes on when things are wrong. And of course, all this information can potentially be applied to medical problem solving. However, that's not what really happened. So there is a very large track of information with the experimental, cell biologist, biochemist, and then kind of the pharmaceutically oriented physicians who depend more on prescription medications for solving people's problems. So I'd like to figure out why people get what they get. And once you have a handle on that root cause, it becomes more apparent what path you need to take to solve the problems. And it can be very complex, as it was in the case of Stacy's situation. However, the outcome is excellent.
It's cancer is that, it's such a terrifying word. It's such a terrifying, like I was telling Stacy earlier, it's to even associate and have this conversation. A lot of people have to bring themselves to a certain level just to have a conversation with somebody that they know about cancer, because it's such a doomsday, word. With Stacy's situation, when she reached out to you, were you already kind of performing these trials, or I guess you wouldn't call it trials for people? Were you already, when she reached out to you, did you already have a idea of a plan to attack with what she had?
Yes, and sometimes new patients bring me new challenges, and it stimulates me to do research. It's very interesting. There's a lot of information that's available, but simply not utilized, that can help us in our problem solving. Now, when Stacy first appeared to me on the screen, like today, she was unable to speak for herself. She was very weak. She was in total body pain. Her husband had to talk for her. And she has a cell type diagnosis that, of course, everything in Western medicine is kind of fear-based when it comes to cancer. It's like, triple negative breast cancer. Think, oh, that's terrible. There's no receptors to work with. Just like stage 4 cancer, it's almost like Humpty Dumpty. I don't know. Maybe you're in too many pieces. You can't get fixed anymore. And so, but I don't look at it that way, because if you separate out the problems and kind of find underlying causes, then you can make a path. And I usually make a path that has different phases in the plan. So there's acute phases, and there's maintenance, and going forward in time. And if you can separate things out, then the problem solving becomes more apparent. And frankly, I think one of the biggest problems we're facing in medicine is people don't want to think. They're not trained to think and problem solve. They're trained to look at the decision tree, take the next step as how the book tells you what to do, or, look for that perfect drug. Well, the body is a miracle, and it's a multifunctioning universe of interactive activity. And so body's made to kill cancer. So if your body doesn't kill cancer, it isn't because you got a lemon. It's because there's something wrong in your body that's preventing your immune system from functioning properly. And so even just that basic insight is a very powerful one, because it means that if we can figure out what those problems are, then we can help stop abnormal activity and prevent it from coming back again, which, is the name of the game.
Doctor, would you say the nutrition of today has a lot to do with the illnesses that we're being exposed to?
Well, it's kind of everything. I mean, people don't eat well, but then, what does not eating well really mean? There's a lot of chemicals and preservatives in our food sources. There are a lot of viruses, not just COVID, Epstein-Barr, many other viruses that can seriously and negatively affect the function of your immune system. Then we have EMFs, all these devices we're using, and the radiation and frequencies that we're being exposed to. Our body is literally like the microcosm of a universe. We have different functioning organ systems, and they're all connected and communicating in a variety of ways. And so when you add extra stressors or things that the body's not made to tolerate, it becomes a challenge and can create imbalance. And when there's imbalance, then there's problem. So it's kind of everything, hate to say it, but
And so, Stacy, when you reached out to Dr. von Schaefer, did you expect this type of a response? I mean, this was kind of your last effort to take the matters into your own hands. What was that experience like, reaching out to her, and then she basically has performed a miracle with you?
Yes, yes. Well, as she mentioned, I was completely unable to speak. So initially, I came to her with two large masses in my lung. And, Dr. Von Schaefer stood out because one, there was a level of urgency that I hadn't felt before. So we had done other interviews with other doctors, and it was either all alternative or it was all standard care. And Dr. Von Schaefer was one, she had a plan right out of the gate. She wanted to see all my documentation before we even met with her, which was so unique, because then she had a plan. As she mentioned, she had a plan when we actually spoke to her, and she completely stood out from the others that we were talking to, because she, and I think she'll mention this in a little bit, utilizes alternative in addition to the standard care operating type of treatment. And she's very unique in that way. So it was hands down. It was, I think, Doctor, if I remember correctly, we talked to you on a Thursday, and I appreciated her being like, get down here. We want to start. And we didn't skip a beat. I was really, really struggling, couldn't talk, could barely walk. I remember I was staying with a family friend that had stairs, and I couldn't go upstairs because of all the inflammation. And within a few weeks, we started seeing huge changes with the inflammation. And it was a
Really?
no-brainer at that point. It was like we finally saw hope, and she provided the beautiful light of hope that we hadn't had before. And it's been a miracle. Yeah.
Wow. So, Dr. von Schaefer, when Stacy reached out to you, and you, like she said, you need to get down here right now. What is that first step? What are you searching for? How do you put together the game plan?
well, obviously I look at what's been done before and what the reaction was, how it worked, how it didn't work. I also use some testing that's performed by a research lab in Greece that tests the patient's circulating tumor cells and stem cells. In other words, there's two aspects to cancer. One is the thing you can look at on a scan or feel. You have a tumor or a lump. Okay. The other aspect of it is the microscopic component. What are the circulating tumor cells that are shed from the tumor? What are they doing? What are their characteristics? And then also, what elements in the body can make the perfect storm for those stem cells to grow and set up shop and make a new tumor? And in the case of stage 4 cancer patients, such as Stacy, I mean, we already had a lot of new set up shop places. So
Mhm.
we know that there's something going on that prevented her body from overcoming this kind of secondary wave of cancer development, despite all the things that she did that everybody told her to do, chemotherapy, surgery, you name it. I mean, she did it. So the biggest component is what's lighting the fire, and it's inflammation, and it can come from many different things. And so many people like Stacy, when they're so very, very sick, we need to cut the inflammation and help her immune system kind of catch up from all of this assaultive activity. And in the case of lung cancers and lung tumors, often there's a component fungus there because just the nature of the kind of milieu of the lungs. They're moist, they're dark, and it's kind of like mushrooms. They can grow in there. So fungus is something that we have to off, and there are different ways to do that. But when I saw Stacy's case, I had other triple negative stage 4 cancer patients that I had previously treated with what I would call a phytoceutical or a plant-based medicine. And there is something in Korean medicine, use of angelica root. An extract of that is called decursin. And decursin is extremely powerful agent in treating either faintly estrogen receptor positive cancers or triple negative. Okay. And it's, the whole thing of cancer is, even though it's scary, to me, biochemically, it's kind of beautiful because it represents the cell's indomitable will to survive despite any kind of negative influences that it may have to encounter. So these cells are dying like they're the only cell, dividing like they're the only cells in the system, which is very paradoxical. And all of the mechanisms that we have, that we know of, that regulate cell behavior and life and death are kind of turned to the dark side, seemingly, so that these cells can grow and thrive. Only problem is they're tumors and they don't belong. And they're hurting other cells and taking away resources from the normal cells that are dying and being replaced. So this root is very interesting because it turns back on a regulatory mechanism called the trail death ligand system, which is very a testament to the creator because it's so complex and so beautiful, and yet it's turned off in the case of cancer. And this root helps turn this mechanism back on to identify and kill the cells that don't belong. So it's a very fascinating project, and a spiritual one in many ways, because a patient who has, tumors everywhere. I've come to tell people you have stuff in places. Why? I mean, I'm not going to scare, you can look at your PET scan report, it's bad. Okay. But that doesn't mean that it can't be treated successfully. So, even when I talk to patients like how Stacy was, we have to sort of stand back from the situation and not react in fear and terror, but also get more information because knowledge is power.
Right.
And if we can create a power base as opposed to a fear base, then people have a chance. They can give themselves a chance. They don't have to respond to everybody else looking at them saying, oh my God, you've got stage 4 cancer. There's tumors everywhere. You're not going to survive. I mean, Stacy's tumor, the biggest one, went from the central portion of her chest out to attach to the chest wall. Okay, and we treated it with a variety of modalities, and now it's about a nut-sized scar.
Wow,
That's it.
that's amazing.
And so the interesting thing that I came upon about the time I met Stacy was that I was looking for some way to eradicate tumors that were kind of all over. So, you know, some people have tumors up and down their spine, they have tumors in their liver. I mean, you know, it's like, where do you start? And also, you know, how much chemotherapy do you have to give somebody to make all that stuff go away? You know, probably too much, you know. And if all you have is cytotoxic drugs that are going to kill cells, well, then, you know, you don't have very many good tools in the box either. So one of the things I was looking for and finally found was a technique called brachytherapy. And I have the good fortune to have a colleague who's a international expert in utilizing this technique and applying it to treating metastatic tumors. And so with in kind of partnership with him, we developed a way of looking at these people's tumors from a slightly different point of view. And yes, I cut inflammation. I give people low dose chemotherapy. Then we have brachytherapy, which involves implanting little grain of rice sized seeds of a radioisotope. And it's covered in titanium, and that can be directly inserted right into the tumor and it'll kill it.
Wow.
Okay. So that's very handy because if you can kill the tumor, it stops shedding circulating tumor cells and stem cells. Okay, so we're not having more and more, we're killing it. Okay, and it dies and kind of turns into a scar.
Wow.
So sometimes in the case of Stacy, the scar went from a big thing to a little tiny thing. Okay,
That's amazing. That's such an amazing.
it's super cool.
Gosh.
Super cool.
I mean, I love what I do. I mean, I found my dream job. This is such a fun thing to do because you can help people, you know, restore their zest and hope for life, and not just in their minds, but in a reality in their body. And this is a great gift.
Doctor, you had made a comment earlier about, you know, you fight the battle within, you know, to kill these cells, the cancer from living. I mean, we've heard through, you know, different means, sugars and you know, some carbohydrates and stuff like that, that help to fuel those the cancer cells. Is that something that somebody can, you know, obviously take their nutrition and their like certain foods that they can eliminate from their diets to help fight and be a part of the battle?
Absolutely. I mean, I like to do a couple of things. I like to have people take some kind of food sensitivity test because many times we may be eating things that we're intolerant of that cause inflammation. So the name of the game is number one, cut the inflammation every way you can. And yes, through diet, it is entirely possible. Okay. The second thing is to be reasonable and think about the fact that, yeah, you want to kill the bad cells, but you have to keep the good cells alive because the cell turnover of your normal cells is every 5 to 120 days. So you can't just kill, or you got nothing left. Okay. So it's very important to, you know, look at all these factors. And yes, diet helps. And it's also a place where people get into trouble because there's so many fads.
Right.
Look on the internet. I mean, there's this diet, that diet, you know, these recommendations, these supplements. After a while, it just makes a person desperate and confused because there's just too much, you know, must-haves or must-dos. Okay. And the concept that, you know, cells cancer cells make energy anaerobically. So yes, they like glucose as a substrate. So no, you should not be eating sugar. Okay, and you should be cutting your carbs. But you have to eat something, not nothing, or there won't be a person left to treat. Okay. So I don't like it when people go completely on a plant-based diet and lose 30 pounds because, you know, people even getting chemotherapy are going to have times when they don't feel good. They're not going to have regular food intake. And we can't have people be in a marginal state. They have to be able to tolerate treatment. Then comes the other issue that with Otto Warburg, the biochemist, the famous one who established that cancer cells make energy anaerobically, along with all the other bad boys like the viruses, bacteria, parasites, fungus, and candida. Okay, there's a lot of going on there. That's very good information. But then it finally came out that there are many cancer cell types that make energy both with mitochondria or oxidative phosphorylation and anaerobic metabolism. So they're AC/DC. So you can't just say it's only the sugar thing. It's part of it, but it's not all of it. Because if it were that simple, everybody would be eating sugar and they wouldn't be having cancer.
Yeah, when you meet your patients for the first time, do you attack it the same every way, or is each one individual?
Everybody is an individual and everybody comes at a different point. Okay. I mean, every once in a while, I get somebody who's, lately I've been getting a few more people first time diagnosis, and people are becoming aware that maybe going through the whole mechanism of activity, treatments, whatever that traditional oncology is recommending might not work so good. They might not have a good outcome. And at the same time, they may be giving up a lot of their lifetime. I mean, Stacy, I can't remember exactly how long you were in treatment at first, but
Yeah.
it was a good chunk of your life.
Yes. Yeah, multiple years.
So I've also been trying to create new ways to kind of fast track things. And I've been presented with a number of patients that have particular challenges. Say, for example, somebody who has type 1 diabetes, they're not a good surgical candidate. I had a patient who came to me and she was stage 4 at the time of diagnosis and an older patient. And I didn't feel that it was going to be successful if she went the route even of a regular biopsy or lumpectomy or any kind of surgery that would be something that you would normally be recommended. So I treated her with different systemic treatments, but I did have her have brachytherapy. And at the time of the brachytherapy, they did a biopsy so they could tell the receptor status and all those things. And of course, she also had tumors in her liver, so they were treated at the same time too. And then we continued to treat afterwards. And this patient now has her primary breast lesion is pretty much a tiny scar. And it's not even going to be useful for her to have it removed. It's dead. Okay.
Wow.
And I had another patient with sleep apnea and all kinds of metabolic disorders. Okay, this poor lady, they were going to try and have her have 12 hours of surgery, cutting the tumor out, reconstructing the breast, then having breast reduction on the other side. Okay, this is very bad for the immune system, and it can really be a factor in early recurrences. So I had her treat with me, and I treated her before her brachytherapy. Her tumor was about 50% smaller when she went to have brachytherapy. She had the brachytherapy, and interestingly, when we biopsied the tumor the second time for that lady, the characteristics of the tumor changed, and actually it gave some very, very interesting information. So that there's this assumption that once you have a diagnosis, it's always going to be the same. Okay, it's going to be ER positive, it's going to be PR positive, it's going to be HER2 negative, or it's going to be HER2 positive. Well, now I see when we look a second time, not only is the aggressive nature of the tumor changed, the Ki-67 score, but lo and behold, it dropped a receptor. Sometimes they even add a receptor. Okay,
Wow.
cancer is not as simple as everybody wants to make it. And that's why these kind of Betty Crocker recipes for cancer for different cell types are becoming outmoded. It's not that those parts of those therapies or regimens aren't good, but there's a lot of it that just doesn't encompass the entire set of issues. Doesn't
Wow.
cover the whole story.
That's crazy.
It's really fascinating
Doctor,
because
when you set out for your, through medical school, did you always have this destination of where you're at now versus when you started medical school?
well, interestingly, I was dreaming about it when I was a pre-med. Um, I had my first pregnancy was a tumor, and that's what made me want to be interested in medicine. I was a dropout from college, like 10 years. So I went back to school. I went to medical school, and I had my first child born, and it was a very difficult delivery and C-section. I could hardly walk for a month, and my friends came and kind of picked me up and helped me study so I would not drop out. Um, and around that time, I had a dream about treating patients with light and curing things without knives or drugs.
Wow.
You have a dream. I kind of think, oh, that's really cool. Not sure how that's going to work. And then I studied cell biology and biochemistry, and I really wanted to do an MD PhD, but I had by that time 5 children, and I had to keep going to kind of make some money there, because the crowd was hungry.
Right.
And so I became a surgeon, and because this surgery interested me, and I like the beauty of anatomy. And I was a surgeon, a general vascular trauma surgeon for many years. Had a spinal cord injury, and I had to stop doing all that. So I lost that career entirely. And in my recovery from that, I learned about bioidentical hormone therapy, and kind of started looking at other ways to treat problems besides what my very high class traditional education had taught me. And pretty much it seems like every time something happens in my life and one path is kind of cut off, another one is opened. And that's kind of how I got maneuvered into this. I was taking care of my sister as a family member, and she had cancer. And, it started out leukemia, then it transformed to a lymphoma. It was a very bad case. She was elderly, and she loved sugar, and she loved drugs.
Wow.
So that's the route she went. And, she lived for about 3.5 years with it successfully. And then the drugs didn't work anymore, and they put her on an experimental drug, and she died in 3 weeks.
Oh boy.
And after that, then it was not a pretty death. It was bad. So I just, kind of thought about it. I thought, I think I can do better. And of course, trauma surgeons are very expert in metabolism and intensive care. And I did all that work by myself when I was a surgeon. And so it seemed like a natural kind of synthesis of many experiences that I had in my life taking care of patients in various aspects of medicine and surgery, that cancer actually is, to me, the most interesting and exciting, challenging field that you can possibly choose to practice in medicine, because there are so many opportunities for generating a different perspective and finding new ways to treat hard to treat old problems. So,
That
like I
is,
said, it's my dream job now.
it's what type of, if any, I'm probably assume that you did, but what type of backlash, or once you made that decision to kind of transition and go across the bridge from your traditional peers of traditional medicine, the way that you were taught, versus what you are assuming learning as you go, even now, your research and kind of transferring over to this alternative way and medicine that you're like on Stacy. What was there any backlash from that, from the people that you?
Well, it's always difficult. And I mean, my patients who have to go to the hospital will attest to it.
Yes. Mhm.
Stacy, you can pipe up right now because
Yes.
let me
Yes.
make it
Oh
real.
yeah. I've been cornered. I've been threatened. I've had people tell me if I continued, I was going to die. Yes. A level of abuse I would have never expected coming from a medical profession. Yeah.
I
And
mean, my latest phrase now is, okay, bullying is illegal in schools. How come
Yeah.
it's legal in the hospital?
Yeah.
Patients are bullied and
Yes.
they're
gosh,
made to be fearful.
Yep.
And, you know, I mean, the law, the right to try, good old Trump. Okay, you can have the right to try, but you better be willing to stand by it because people are going to come after you. And I
Yeah.
mean, even in pediatric populations, parents are threatened to, have the court take their children away from them because they don't want to agree to terrible maiming treatments. It's a tough world out there, and I have to practice, be extra careful. Not that I wouldn't be, but I really have to be extremely careful in how I choose my patients, and because if a patient believes in what I'm doing and trusts me, we're going to maintain a good relationship. If people have a lot of questions and they're just not sure, they don't want to do it, then maybe it's not for you. Because as Stacy said, I mean, you'll be challenged. Even patients are
Yes.
challenged totally inappropriately. It's unacceptable. And
Yes.
this is an area that I wish to change, to be
doctor,
honest with
obviously cancer has been around for quite some time. I mean, I always say it goes back to, kind of the food industry. As soon as they started, processed food, sugars, this and that, probably went back further past that. But this is one of the biggest organizations to fight this disease. I mean, we've put people on the moon. We've protected, we can protect our country from, missiles and this and that. How come we can't get a hold of cancer?
Well, if you use only one point of view, you're not going to get too far. And there's too much money in keeping people sick. Stacy, you're nodding your head. Yes. I mean, it's
Yes.
crazy, but people make a lot of money off of cancer patients. There is cutthroat competition for patients among large institutions. And the more corporate medicine is corporatized and doctors become employees, then they are beholden to their employers to do what their employers tell them to do. I mean, I've treated people who, kind of went to their same oncologist at MD Anderson while they were treating with me. And, I remember this one case of gastric cancer. The doctor said, I don't know what she's doing, but whatever she's doing is working and you should keep doing it. Other physicians would say, I don't care if it looks like you're doing well. She's still going to kill you.
That's
Yes. Yeah.
it's such a crazy, way of thinking, because you hear many. I mean, we're in the technology world. I mean, people can go and research, like Stacy, research found you research, I mean, it's you never stop. But it's like there's still the naysayers, and it's like you have to go this way, even though there could be another method, another way of, like you said, even just cutting down the inflammation. Okay, whether that be food, whatever that is, there's ways.
Multifactorial, and it goes a very, very long way. And I've had many patients who come to me very, very sick, and the first like week or two, all I do is work on cutting inflammation and diagnosing whether or not they have viruses. Epstein-Barr virus is the kingpin of all solid tumors, not just lymphomas and leukemias, and you must get rid of it if you want to get rid of your cancer. And this is a thing that is not recognized. In fact, it's only starting because there's some new research that's been released in the last 18 months to characterize the microbial signature of 90 some different kinds of cancer cell types. And the conclusion was in their research that each of these 90 some cell types had a different group of friends. Okay. So that means that there's got to be microorganisms that can set that stage, that biochemical terrain, so that it's conducive for cancer cells to thrive. And they estimate that approximately 50% of tumor volume, like a tumor, a lump you can see, is actually microbes that are so tiny you can't see them with the naked eye. That's a very interesting thought. And I've noticed that when I treat microbes very, very aggressively, people's tumors go away faster and they stay away.
Mm.
So this is going to be the cutting edge of our way of looking at things. But I don't know how long it's going to take for this information to trickle down because I don't see it being utilized even now. I mean, leukemia has to be related to a virus. But, you know, I have 2 pediatric patients I consult on. I don't take care of them, but nobody's even checked for Epstein-Barr virus, much less consider treating it.
Do you find have you ever had any of your peers or anybody that has, you know, were the ones at the beginning saying, hey, she's gonna kill you, this and that? Have you been able to change anybody's minds the way that the path that you're down?
Well, I'm not going to say I try and change somebody's mind because if somebody's going to talk to me like that, pretty much there's probably no way to change their mind.
True.
They have already made a decision, which is like, okay. But even my colleague, Dr. Doggett, who does the radiation oncology
Yes.
component of the brachytherapy, he's so nice. He said, well, you know, every time I talk to you, I learn something new. People are not talking about all this stuff. They're not.
Right.
And it's not being taught in schools either. You know, the number one, you know, assessment for cancer that's still going on but not really proven out is that it's from a genetic aberration. Okay, not all, you know, maybe yes, maybe no, but it has to do with even changing of epigenetics in our macrophages or other immune system cells that makes the problem. It isn't just, you know, oh, you were born with bad DNA or, you know, something like that. And it's not just all that. I mean, even people with this BRCA gene, you know, from Ashkenazi Jewish heritage. Okay, I have a BRCA positive patient who I treated. She didn't even get a mastectomy. She had a lumpectomy and she wanted to have children. So she didn't have chemotherapy. She had a baby and she's fine. She's not dying of breast cancer. She's not dying of pancreatic cancer. But
So
there are many increased incidence of cancers in endocrine glands like the thyroid, adrenals, obviously breast, but also pancreas that are probably very much related to the EMF emission from all the devices that we spend so much time with.
so doctor, do you feel everybody is born with these like cancer genes? It's just whether or not they're exposed or they expose themselves, or is it some?
Not everybody is. I mean, like I say, there's a group of genetically caused cancers, you know, familial polyposis. There's a bunch of, you know, I mean, like a child that's just born that has a cancer. Okay, you know, yes, there might be some utero exposure, but probably there's a genetic problem. You see what I'm saying?
Mhm.
So there's that kind of thing. But then there's the kind of garden variety, like you live life and then all of a sudden you have cancer. Well, we know that many cancers have their basis in infectious agents. Gastric cancer comes from H. pylori untreated. Okay. Cervical and head and neck cancer, HPV, human papillomavirus. Okay. Then you add untreated Epstein-Barr virus, which is pretty much endemic in the population and transforms macrophages to malfunction. Well, yeah, you got a lot of chances to have cancer just being alive in this environment. So you know, you kind of the name of the game is you have to control what you can control and then be on the alert. You know, don't assume you'll never get it because you're right now 70% of the population is going to get some kind of cancer. This is the epidemic nobody talks about.
And you're right. It is one of those epidemics, and you know, a lot of the patients, you know, Stacy's obviously not traditional, but you know, kind of accept the word of their doctor that this is it. This is the only options that we have, And you know, I think we're becoming more and more educated as patients that, you know, it isn't the last word. You know, there's always another alternative, you know, like yourself versus a traditional doctor, you know, might not have that same, you know, path for as she is where she's at now, to where, you know, it's like one way or the highway type thing. And I think we live in a world to where, you know, education, self-educating, you know, via the internet, our own research and stuff like that, which is exposing more and more people like yourself to other ways, not just this is the one way and or that's it type thing.
Well, I mean, if the one way worked, okay, fine, but it's not working. I mean, look at Stacy. She did everything, right?
Everything. Mhm.
I mean,
Right.
she did everything and it didn't work. Okay.
Right.
And a lot of people know a lot of people, and they know people who have cancer. They've seen people die after one session of full dose chemotherapy. I mean, it's kind of scary because people are talking about it now. And I think that's a good thing because, you know, you have to work to have an open mind about what other options are available to you, and that it isn't just this one way of total torture.
Doctor, where do you think
Right.
what do you think the time frame is for chemotherapy to be a way of the past? For I mean, because essentially what we're doing is you're putting toxins, you're killing your body, and you mentioned your body has to fight from within. And if we're killing our body inside, we're almost exposing ourselves to other things to take to kill us.
Yeah, I mean, poison is poison, okay?
Mhm.
But, chemotherapy only does one thing. It can kill rapidly dividing cells, okay? And a tumor mass with persistent metabolic activity is going to keep shedding tumor cells, and they're going to go places, and they're going to hang out and wait until the perfect storm occurs and a metastasis is made. Now, for some people, when I see them for first time, they already have metastases. And, we still have to figure out why, but that's another kind of a person. Now, recently, I've been seeing a lot of people who have, say, an isolated small recurrence, one place. Okay, if you do a PET CT scan and there's no other metabolic activity big enough to pick up on, and that imaging test, then that person doesn't need 6 months of full dose chemotherapy to fix their problem. They need to kill that tumor, stop it from making shedding other cells, and then treat their metabolism, kill the circulating tumor cells and stem cells in other ways, get rid of the viruses, and move on and live your life. So I have a number of patients where I'm using this therapy. I've done it to several people already. I mean, if your PET scan is negative and you only have one tumor, put seeds in it and kill it. Some of these people need chemotherapy, some don't. I have other people who come, they don't even know where the primary tumor started. They've got big tumors in 4 or 5 different places. Okay, I'm going to use low dose chemotherapy on those people because otherwise they're not going to have a chance. So it requires some thinking to figure out what is the best for each individual's case. And not everybody who is my patient gets or needs chemotherapy, even in low dose, but many people do, because if they come to me with a lot of tumor mass and tumor activity, I've got to get a handle on it.
Mhm.
What
So
with
I don't think chemotherapy is ever completely going to go out of style. Okay, fine. And where does all this stuff come from? It comes from plants, most of it, except for these designer drugs that are immunotherapy agents. But like the Taxols that we use in breast cancer, this comes from the yew evergreen bush. Okay, God gave it to us. So botanists have figured out that you can use all 70 of the taxanes that are in the plant, not just 2 that are modified and sold as the Taxols, paclitaxel or docetaxel. by drug companies, but I mean, the plant is the plant. It's a naturally occurring substance. And so I think phytoceuticals, yes, plant-based treatments have a great place. And it's just that our culture doesn't venerate that or value it. The Japanese are probably the forerunners in research about plant-based treatments. American Indians, same thing. They have herbal chemotherapy. So I think the concept of chemotherapy is one that is not going to go away because it's needed. It's just how do you use it and what are the agents that you choose and in what amounts. That's what needs to change, I think.
Doctor, do you feel cannabis has any place in modern medicine?
Well, I have patients who have bone pain and bone metastases, and I recommend that they use it. THC alpha is very good for adding to bone density. It's a little hard to get a hold of, but and there's a lot of literature. People say leukemias, they use the THC and the flower, they cook it and all that, and it really helps their healing. So I think again, this is an area that deserves more attention, research wise. But anecdotally, people are finding benefit.
So can you explain to me the treatment with Stacy? So she's now hopefully on this way out off this pier, but the vaccination is the next step, correct? That's what
Right,
we're
right.
really focusing on.
So we cut the recurrent lung tumors, and their activity is nil. Stacy did get some brain metastases, which were successfully treated, and now she's in a position of kind of you have to restore the function of the immune system to accept this particular vaccine, because this vaccine is based on simply bypassing the impaired recognition phase between the immune system dendritic cells that are supposed to be watchmen and communicating the information to the rest of the T cells and the B cells. But cancer cells have a unique ability to cloak themselves. I would say it's kind of like the Klingon ship in the Star Trek. Kind of there, but you can't really and kind of what it is in cancer, because the cloaking of the cell with this kind of gelatinous nagalase substance is impairs very precise recognition of surface markers that the dendritic cells need to have to function effectively. So when this therapy is created, the patient's blood is separates out their own dendritic cells and then separates out the circulating tumor cells and stem cells. Those circulating tumor cells and stem cells are then stripped of all their surface markers, and everything is collated to find the one marker or epitope, as they call it, that's most frequently in that whole population expressed. Okay. And then they take the patient's dendritic cells, mark them with that epitope, and then augment that population. And then the therapy is to get 3 different infusions of the patient's own prime dendritic cells 21 days apart, so that the immune system has an opportunity to get that educational process between the dendritic cells and the T cells and the B cells completed, and then to move that marker into what they call the memory bank or the memory cells, the CD28s. And once the CD28s population increases, then we know that that's in the memory bank of things that don't belong in Stacy. And then the immune system can go forward in time and function appropriately and identify and kill any cancer cells that might be noted. So this vaccine treatment is very effective, not only for killing circulating tumor cells and stem cells that are not actively dividing, but it can also kind of eat away like Pac-Man on existing tumor mass, may it be present. And I have had patients with pretty good size 4-centimeter tumor that just disappeared in 6 months after a vaccine. So it has some residual cleanup value as well.
Is this a new? Is this vaccine something new, relatively new, or has it been?
About 10, 12 years old. I
Wow,
mean, I've been using it for almost a decade, very successfully.
Mhm.
The only time it kind of doesn't work is if too many of the cells that have that marker are killed off, and another subpopulation clone that's been held in a small, uh, limited population may burgeon and grow, and then that vaccination won't work. So to bypass that, missing that information, I have patients get what they call a SOT treatment or a supportive oligonucleotide therapy, which is something this also makes. And it helps us assess the microscopic composition of different clones of people's cancer cells over time. This is an amazing therapeutic, not only diagnostic, but therapeutic tool. And the cell biology and biochemistry for this has been documented in the literature for a very long time, over 15 years.
wow,
And it's that this research lab is very much geared towards these things, and they are, light years ahead of everybody else because they've been doing it for so long and so successfully, you know.
Wow.
why do you think that? Because you said this is in another country, correct?
Yeah. Mhm.
And so their means and ways of battling these diseases like this are so much more advanced, or maybe not necessarily advanced, but like you said, the money overshadows the cure. And
Oh, and then also the regulatory agencies that are kind of crooked, okay,
Yeah.
let's face it. People ask me, why are these therapies not ever going to be made in the United States? Okay, the US government knows about these therapies. These people's blood specimens go back and forth, the therapies go back and forth. I mean, they're not, stopping them in customs or barring entry, okay? They know about it, but they can't regulate it because it's not made on US soil. And that's the only reason it's probably never going to be made on US soil because nobody wants the FDA to be involved. There are
Right.
two ways that, wrong can be done under the guise of right if you have enough money.
gosh, and you just nailed it right on the head, is money, and
Yes.
through these alternative ways, it's not paid for or helped subsidized through traditional insurance.
I gotta tell you, I mean, Stacy and I, we're planning on publishing her case. And
Mhm.
one of the things I'm gonna publish is the dollar amount that was spent on her treatment for her recurrence versus the dollar amount that insurance was billed and paid for her primary. And I will guarantee you, there is a huge discrepancy, and it is not in favor of what I do in terms of I didn't charge all that much money. It seems like a lot of money, but when it comes to insurance reimbursement and even drug company kickbacks, I mean, let's face the fact.
Yes.
The only thing in medicine where you can get a kickback is when you prescribe immunotherapy drugs. And if you look on TV and see all the commercials for Keytruda, okay, now it makes sense to you. Let's use
Wow.
Keytruda for just about everything. They are even trying to give Keytruda to triple negative breast cancer patients. And I have 2 patients who had 1 dose, and then now they have horrible complications in their lungs because they're just guessing and using a very expensive drug. And who gets the kickback? The oncologist. You
Mhm.
can make hundreds of thousands of dollars a year by prescribing these drugs. I do not take a dime.
Wow.
Yeah,
Wow.
and I mean,
Wow.
literally, you are an angel, obviously, with your methods, and
Yes.
you're resilient to the traditional medical world. I'm sure you have a shield up, constantly getting bullets hit at you.
Yeah, I'm kind of like the witch doctor of the West. I mean, because I have seen many people die in hospitals, and Stacey, you and I both know some of these people. And
Yes.
it's just come to the point, I call it the oh well generation. Because people want to be on a salary, and it has to do with corporatization of medicine. They're on a salary, they're on a shift. As long as they bring people in, it kind of doesn't even matter what the outcome is. And I've had many patients who should have survived and died in the hospital because of negligence.
Yes.
One person, my best friend included, it's absolute tragedy. And it has to do with the fact that people kind of don't care, which brings full circle to the issue that has to be changed when it comes to having a stage 4 cancer diagnosis. You cannot let people discriminate against you and put you in the hopeless category. I've had people that come in every day, and you know who I'm talking about, and they tell them, you're going to die. You should die. Why don't you go home and die?
Yep.
Get out of my face, because you're a problem I can't solve.
Yep.
This is what happens over and over and over again. And I'm hoping and praying that someone will help me financially, because I certainly don't have it. But there has to be, some hospital beds devoted to integrative care for people who need transfusions, people who need, bronchoscopy. I mean, the doctors are just not doing what they're supposed to do anymore. I don't even know why.
Mhm.
Well,
I mean, these medical school oriented kind of things you do,
Mhm.
and they're not being done, and
Yep.
especially not being done on a stage 4 cancer patient.
well, you just
Yep.
made a very scary comment of, doctors seeing a challenge as a failure, and if they fail at that person with that person, they're looked at as a, level 1 doctor, doctor that can't help to cure, and so they send you home, send you away, get you out of my office, and because I can't do anything about you, so therefore just go and die. And that's a scary thought.
I had a patient, and this was not recently, it was several years ago, and it's very common in women to get a fungating open wound breast tumor. I mean, first of all, people are embarrassed about having tumors. They feel like it's their fault. And then when you get some big infected mass, I mean, I had a patient who went to a doctor, and she was literally kicked out of the doctor's office without even a prescription for antibiotics, because he took one look at it and didn't want to deal with it.
Wow.
Okay, so this is why I say discrimination. Forget about what color you are. Let's just talk about your diagnosis, and then we'll come down to
Yes.
really
Yes.
important, because these are
Yes.
the people who are suffering and trying to save their lives and going to medical institutions and physicians for help and being denied
Yes.
because their problem they can't solve.
Hmm.
This is
Yeah.
this is where we're at. I don't care how horrible it sounds. This is where it's going here.
Do you feel
Yeah.
like we're close to the top of this peak, that things are going to change?
Well, I'm hoping that having an opportunity to speak, in a venue such as yours, and maybe many others, we can help raise awareness
Yes.
and bring the humanity back to this lofty profession. We have ethics, do no harm. Okay, how can you say you're upholding that vow when you send someone away knowing that they're not going to have any hope and they could just go home and die without you even trying?
Gosh, and I would like to think that the doctors such as yourself are growing. The modern way of thinking of medicine and care and path to being cured is changing, and I'm hoping that's again, you are obviously an angel, and hopefully there's tons and tons of more people out
We're
there like
trying.
yourself.
We're trying. It's an educational problem, Randy. This is the big issue.
Yes.
Is if
Yeah.
you're not educated to problem solve. I mean, this is I'm gonna get a little political here, but this is the
Yeah.
component of fascism, the subtle component that we are experiencing in our society today. And it has to do with the way we educate our children. I have 5 children myself. I encountered it in my kids when they were in middle school, and now they're in their late 30s, so that ain't new. Okay. But if you teach someone there's only one way to solve a problem, what are they going to do if they try that one way and it doesn't work? They're going to get frustrated, they're going to get angry, and they're going to give up. Many people just give up because they have been taught there's only one way. So the least we can do is encourage creative problem solving and teach people, even solving math problems. There's always more than one way to do it. I had an argument with my own children about that. Mom, you
It's
can't
so
solve the
true.
problem that way. And I go, okay, I'll do it my way, you do it your way, and then let's compare our answers at the end. Very interesting. It worked.
Doctor, do you have a group of others with your same way of thinking? Do you guys have like your own
We're
conferences?
trying. We're trying. Our tribe is tiny right now. We're working on it. My goal is to, in the next year, publish these cases, the Breaky Bunch, okay? And so that, because even in the traditional literature of radiation oncology, no one is doing this. Very fascinating. And I mean, we're having so much fun helping people. It's really exciting because,
It's awesome.
if you can
Yes.
take somebody and have them have 2 months of low dose chemotherapy and brachytherapy, and then they can move on with their lives as opposed to 6 months of full dose chemotherapy and then surgery and then recovery. I mean, you're talking a year out of a person's life. Okay, when you're a single mom and you're supporting a kid and you're a solo practitioner, okay, you haven't got time for that. You don't wanna give up that much of your life. I mean, Stacy, God bless you. I did have to have you a long time, but you're
We
probably,
got there.
I know.
Yeah, we got there.
We sealed the deal. So I
Yes.
think it's just, we're trying. It's my answer to your question.
And doctor, with the success that you're having with Stacy, how does that make you feel? How does that the endless hours, probably the friendships that's collapsed in the path, how does this result make you feel?
Well, I mean, I do this for the love of people. It's my gift to give back. I could be sitting at home and doting on my next grandchild, but I'll have time for that. But this is something that I think is a culmination of a lot of God-given experiences that I had in my life. And it kind of all gets put together in this work to help create success for people. And, there's the trauma surgeon still in me. We like to operate on people and save their lives and give them their life back. And this is a way for me to do that without a knife in my hand, you know. And so it makes me very happy, and I feel my purpose in life is fulfilled every time I help someone like Stacy. At the same time, Stacy, both myself and every member of my staff loves our patients. And I think loving makes you vulnerable, as we all know. And sometimes people make it, sometimes they don't. Not everybody is going to survive. And so it's it's a loving work of dedication to humanity to serve people who are sick and to help them through it. And even if people don't make it, maybe you can help them resolve things that they needed to resolve in their lives and give them extra time. I've had many patients who, survived a few 6 to 9 months after their treatment, but they died in peace as opposed to in turmoil. So, we're here to serve, and the only one who really knows what's going to happen is God.
Yeah.
Like I said, I am so infatuated with this journey, with the practice, with the just and really flabbergasted of the common Western medicine denying of this for people.
Mhm.
And I'm sure you are too, doctor. The fact that this medicine, this journey, it's working. It's helping. It's helping people having a better life. It's extending their life, curing, having a life. And it's one of those things to where it, obviously I don't have any answers, but it's people like you that give people hope, like Stacy, which is awesome. Awesome.
Yeah, it's
Thank you.
amazing.
It's really a blessing to talk to you today and to have your listeners hear this information. We're working on things. We're trying to change things. And of course, the people who are able to come to me are helping me understand, how to do these things better and lay the groundwork for teaching in the future, which is definitely my goal, so that others will know how to do this work and pass it on further. So things are a little dark now, but I'm hoping that it'll get better, right, Stacy?
We don't give up. No, we go team go.
Keep going in this
That's
direction here, because I
Yes.
think it's meant to be, and it isn't like we're getting rid of other things, but we're embracing the totality of modalities that are given to us, just like with the plants. I mean,
Yes. Yes.
plants are ancient, and there's much knowledge you can get from even yeast.
Right.
So, we're
right.
always working to find the better way to do things,
Awesome. Well, doctor, we appreciate you. I don't want to take any more of your time. I know you guys are on a time schedule, so I would definitely like to have, another follow-up here, in a few weeks.
Love it. And we're here to share.
Yeah, and like I said, I mean, we would love to be, your voice in, with our platform to get this information out, the awareness, and we appreciate being a part of the journey with you and Stacy on this, and looking forward to that finish line pass to where now others can be exposed to this information that may or may not know about it.
Yeah.
Yes.
Well,
Yes. That's our goal. Yep.
Bless you, Randy. Thank you so much for inviting me and also giving some press to Stacy. She deserves it. So all of us who are involved in this are just trying to make it better for those who follow us, and hopefully we can have many people who can embark on this journey in one part of it or another, so that they can survive and thrive.
And doctor, you have Facebook, social medias, and all that stuff.
Oh, we got all that. I have a website. It's Virginia von Schaefer, MD Inc. And I was hoping we could post this on YouTube so we can
Absolutely
see it, because
Yes.
gotta get the word out.
Yes, ma'am. Yes, ma'am.
Yep,
Anything that we
yep.
can do to help get the word out, we are here for you.
Okay, thank you so much, Randy. Bless you for all that you're doing. Appreciate it.
Awesome, ladies. Thank you
Thank
so
you.
much, Stacy, Dr. Von Schaefer.
Thank you.
We appreciate your time so much, and look forward
Thank you. Thank you.
to that finish line for you.
Okay.
Thank you,
All
Randy.
right. Bye-bye.
Okay. Bye-bye.
Wow, that was super awesome. I mean, that was, I don't know about you guys, but that was an amazing interview with Dr. Von Schaefer. Stacy Athon is an amazing person, and reaching out and doing her own research to get her own answers and get her own resolutions. But guys, I hope you guys enjoyed that. Stay tuned for more stuff from Stacy and Dr. V, which I look forward to. But as always, guys, we can't do this without you and our sponsors. We'd like to thank Escalar Wines, Wine Travelers Hideaway, Visit Atascadero, 805 Customs, Santo Brothers Plumbing, Hanson Enterprises, Story Termite Pest Control, Borhone Auto Center, Airflow Filter Services, Kennedy Club Fitness, and North County Junk Removal. Thanks again, guys. We'll see you next time.
Hi, this is Dave Story, small game hunter with Story Termite and Pest. We're a full-service termite and pest control company. From rodents to termites, we can take care of all your pest control needs. Call today. We can tailor a pest control program that will meet your needs and budget. Contact us at 805-460-0650 or at storytermite.com. Remember, we don't have customers, we have friends.
Hi, welcome to Kennedy Club Fitness, where we have something for everyone. We have weights, cardio, group exercise classes, racquetball, basketball, swimming, and pickleball coming soon. Here at Kennedy, we're committed to health, wellness, and community. Stop by any of our 4 locations: Paso Robles, Atascadero, San Luis Obispo, and Arroyo Grande, or check out our website at kennedyclubs.com.
What's up, North County? This is Teresa Branch with Airflow Filter Service. We are a family-owned business right here in the North County. We have air filters, oils and lubricants, and hydraulic hoses. We provide services that include air filter cleaning, DPF cleaning, and waste oil collection. Come check us out at 1140 Ramada Drive, and we can help you with all your automotive and industrial vehicle needs.
Hi, this is Omid
and Deanna
at North County Junk Removal. We are a business known for helping our neighbors and our community.
Let us help you save money and get rid of any unwanted items.
And rest assured that our professional team adheres to global standards of safety and recycling. We are fully licensed and insured for your peace of mind.
We are locally owned and operated, and we look forward to helping you with all your junk removal needs.
Please call us at 805-769-6966.
Atascadero isn't your standard getaway. We're unique, just like you. We're growing, transforming, and figuring it out as we go. We're a town filled with innovators, artists, makers, and game changers. We're a little bit country, a little bit funky, and always authentic. We're here for your good times, your slow times, and your changing times. We're all in Atascadero. Come see for yourself. Learn more at visitatascadero.com.
What's up, North County? Nate Santos here, owner of Santos Bros Plumbing. You might recognize me with my dancing horses at local events such as the Atascadero Tamale Festival, Templeton 4th of July, and Paso Pioneer Day. I am now available for all your home plumbing service and repair needs, from minor drips and drops to emergency leaks and clogs. For the best plumbing service, call Santos Bros Plumbing, pipe wranglers to the rescue.